Hi, my name is Tola. I'm the administrator at Seraphic Springs Healthcare Agency. Yes, we did have to change our hiring policies quite a bit because of the COVID-19 incident. Usually, that is kind of the new norm now. Before, we were having people come into the office, they do application online, and we still have to interview them in the office. But since COVID started, we had to throw that out the window, and we've been actually interviewing people via Zoom. We've been doing Zoom interviews, and we've been hiring based upon the interviews that we do on Zoom. And also, we've started doing more virtual interviews and also virtual meetings with staff, because some of our staff, they also have to work, from home. But the hiring practices, definitely we had to change that because we still need people to take care of the elderly in their homes. We had to go to Zoom and start doing interviews, and then even doing training via Zoom. The only incident where we have to have people come into the office is when they are doing the clinicals before they actually go out and start working. And when they do that, we have to make sure that we practice safe distancing with the nurse that is going to train them and assess their competency to be able to go out into the fields. However, we really did have to change all our policies in regards to COVID and to be compliant also. Significant changes now due to COVID-19. Before we had a lot of applicants, however, now we don't. In some locations, we still do have, a steady amount of applicants. However, in some other locations, we're really struggling trying to get applicants to come in. And that's why we really resorted to doing Zoom interviews as opposed to having people come into the office. And that really has helped a lot. At least we've been able to get maybe about 5% of our workforce from doing Zoom interviews and also doing Zoom trainings before they go out into the fields. And they required 3 hours home health orientation. We do that on Zoom right now. However, the clinicals is still in the office with the nurse before we can send them out. But most of our training right now is on Zoom, and even our in-service training is on Zoom or maybe YouTube format. We've been using that format, either Zoom or YouTube, to do the orientation and also the in-service trainings.